Thanks for joining us for we love these programs. These coffee and conversations are so informative. We've got a great speaker for you today. This is Bill Cleary from Oasis, and he's going to chat with you about navigating the many challenging needs of seniors.
Thank you.
Thank you.
Thank you. Appreciate it. Good afternoon, everybody. Welcome, and there's snacks over on the table if you're interested. I'm going to give you some facts before I go into the presentation about assisted living and memory care. The aging of boomers. So 13.4% of U.S. population is over 65. Massachusetts, it's about 17.4%. Newton, I did as close to Boston as I could, it's 18%. And Cape Cod has 48% of people over 65. Population age, 85 old, oldest old. Expected more than to triple. From 5.7 million in 2010, this is 85 plus, to 19 million expected in 2050. So that's a big increase. Age 100 plus. 1900 U.S. Census, there was 3,500 people age 100 plus. 2050, it's estimated to have 834,000 people over 100 plus. 25% of those alive today will live to be over 100. Now let me go into the other one. Okay, again, so I'm with Oasis Senior Advisors. I bought the franchise in 2018, so I've been doing this over 6 years. Oasis Senior Advisors is 140 locations throughout the United States. So what's important about that is if you have a loved one that's down in Florida and the family's up here, we can definitely help with moving the person from Florida up to Massachusetts. So again, there's 140 locations throughout the United States. Oasis was established in 2014, and we have 8,500 business partners. So what that means is we work with a lot of the senior communities in healthcare to help people at either age in place or move to an assisted living or memory care community. My services are free to seniors and their families. I get paid by the community if you move into that community, which I recommended. It's a very personalized service. It's not like a place for mom. I will actually go with you on the tours. I'll find out information from you, what you can afford, where you want to live, what's important to you. Is the pool important to you? Is food more important to you? And I'll help you with all those different things. Okay, now we'll get into assisted living. Average cost in the greater Boston area right now is $6,000 to $9,000 per month. There's a new community that's going up in Brookline right now. It's a beautiful community. It was Balfour, and now it's the Newberry. They got sold in between the construction. The community fee there is $75,000, a one-time fee, just to move in. For a two-bedroom independent living.
Speak a little bit louder.
Sure.
To the microphone.
Yep. So there's a new community in Brookline, and that community is called the Newberry. And what they're doing something unusual. Every community has a community fee, but their community fee is $75,000. It's a one-time fee. What they're trying to do is compete with communities that are buy-ins. So buy-in is where you put down, like New Pond Village in Walpole. It's about $550 for a two-bedroom condo. You buy it, and the family gets 90% of the money back when you either move or you pass on. So with the Newberry, a two-bedroom there is $16,000 a month for independent living. Most communities right now have a waiting list, like Newbridge on the Charles, which is in Dedham. They have a 5-year wait list. So if you're getting interested in any communities, what I recommend, put down the deposit. It's fully refundable, and at least you'll be on the list. And if your turn comes to the top of the list and they call you, you don't have to move in. You can say, I'm not ready yet, and you'll still, next time, be at the top of the list. So you don't lose your place. But you can keep on stalling it as long as you like. 95% of assisted livings in Massachusetts only take private pay. So that means that you have to have the savings to pay for this. There are a couple communities that will take like Section 8 or Medicaid, but in those instances, you have to have no money. So again, most of these communities are private pay, and a lot of them, I hate to say it, is when your money's out, you're out. They will ask you to leave. Yeah, they don't. It's wrong. That's all I can say. But I don't control it. The average age in assisted living is 84. Okay, assisted livings include 3 meals a day. Most of the communities have really good food. There are some communities that the food is not that great, but most of it's like restaurant style. You go in, maitre d' sits you, you order off the menu. They always have 2 specials per lunch and dinner, and then they also have a standby menu. So if you don't like any of the specials, you can offer a standby menu, which may have hamburgers, different types of sandwiches, fish, beef. They will daily make your bed and remove trash from your apartment. They do a deep cleaning once a week where they'll clean the bathroom, the kitchen area. All daily activities are included in this. And each community usually has on a weekly basis about 75 activities per week. So it's not just bingo. They'll go to museums. They'll go out to lunch. They have different socials. They do have like art classes, art lectures. They'll bring professors in who will lecture, and tell people, what's going on, what they're interested in. They do transportation to the doctor's appointments twice a week. And they also will bring you out if you want to go shopping or anything like that. The van will take you. And every community has happy hour. And those happy hours are happy. There was a community in Canton. It was called Brightview, and they had Manhattan Monday, and they had to stop it. They had a 2-drink maximum, and it was too much. And then all, again, activities are included. Okay, so assisted livings in Massachusetts are a social model, not a medical, which means they cannot do a lot of medical care. So they cannot do wound care, they cannot do injections. If you have a feeding tube or catheter, they cannot accept you. So you'd have to go to a nursing home in that case and either get, weaned off the catheter or the feeding tube. Cannot take individuals who need assistance, again, with injections. So if you're diabetic, you can bring care in, but it's about $150 per injection. So if you need a couple injections a day, it's ridiculous. Okay, so at assisted living, it comes with a basic care level, which is usually 45 minutes. A lot of people are under the misconception that if you go to assisted living, they're going to take care of you throughout the day. They don't. Again, so if you start off, it's about 45 minutes. You can break that up, so if you need 15 minutes in the morning for somebody to help you shower, if you need, 15 minutes getting dressed at nighttime or something, they will help you. Some communities have 5 levels of care. The more expensive. So benchmark communities, they start out with the basic care level. I think it's about $1,500 in addition to the rent that you're paying. But it goes up to almost $5,000. And the last care level is for end of life. It's when they bring in hospice, it's usually like a pureed diet, a 2-person assist to get you in and out of bed. So it's near the very end. Okay, so here's to pay for it. There are a couple things. So there is a program called PACE, which will pay up to $1,500 for care. But again, you have to be pretty broke to get on the program. I think you can't make over $36,000 a year. It's not, but they don't look at assets. They don't look at the house or anything like that. It's literally what you're bringing in per month.
Can you speak more into the?
Sure, sorry.
Because you keep moving away.
All right, and then there's a program called GAFC, which is Group Adult Foster Care Program. That one, you really have to make no money at all. I believe it's less than $12,000 a year. But they pick up the whole bill, which is nice. Then there's the Veterans Program, aid and attendance, that if you're a surviving spouse of a veteran, you can get $1,500 paid towards your assisted living. If you're still married to the veteran and you're both looking, I believe it's $2,400. And then, as I mentioned, there's very few communities, but some will take the Section 8 voucher. And then again, of course, private pay. Okay, now we'll transition to memory care. Memory care is very expensive because you're in a secured neighborhood and you have the care ratio is much more, it's like 1 aide to 3 people. But memory care is very expensive in the Boston area. Anyone have a guess? How much you pay? It's between $9,000 and $18,000 per month. I just put somebody in a Vita of Needham, and she's paying $16,500 a month. Her husband was a plastic surgeon, though, so they can afford it. Most have a waiting list of at least 6 months. Like, memory care is in demand. 90% of assisted livings in Mass only take private pay, which again is the same with memory care. An average age in memory care is about 86, and usually the typical lifespan is about 3 years. Memory care also, what they'll do is, it includes 3 days of 3 meals a day. Again, daily bed making, trash removal, hourly check-in. So Massachusetts, if you're in memory care, you have to be checked on hourly. So even at night, they won't wake you up, but they will poke their head in to make sure that, you're okay. You're in bed or you should be where you should be. They'll do deep cleaning once a week. Again, daily activities, outings. It's a lot more restrictive with the memory care people because a lot of them can't really move that well, so they don't do a lot of outings outside. And if they do, any type of activities, it's like, a beach ball and they hit it back and forth. I mean, it's not the best, I would say. Again, memory care is a social model, not a medical, so they cannot do injections, they cannot do wound care. They can't do cats, feeding tubes, anything like that. Again, that, if it happened, you would have to go to a skilled nursing facility. Again, basic care, 45 minutes is included. Again, they have 5 care levels, most of them. And most communities will take care of you to end of life. They will bring hospice in for you, and hospice is free. And hospice comes with its own doctors, which is a good thing. Does anyone have any questions? Yes.
I know that skilled nursing facilities have a rating on Medicare.gov.
They do.
Do assisted living?
They do not.
Memory care?
No.
So how would somebody know which one is the best for their-
By working with somebody like me, and also just if you go, what I always recommend when you tour a community, then if you're really interested in that community, you have lunch. You talk to some of the residents. Get to know, ask them point blank, what do they think of it? Do they like it? What don't they like about it? I brought somebody and they asked somebody, what they thought of the food. And the woman said, it's not your home cooking, but you get used to it. So, I mean, it's good to ask these questions. Find out what people, really think of the community. Yes, sir. They do. It's called White Oak Cottages. It's very nice. Fox Hill is doing something unique now because they have a wait list. So what they're doing is if they have 5 people interested in a 2-bedroom and they have 1 2-bedroom available, they do a bidding war now. There's no more wait list. So whoever pays the most gets it.
Thinking of Fox Hill, when they first opened, they had the 3 levels: independent living, assisted living, and then the final nursing home. And they were all united in the one area. You could walk from your independent, if your other half had stroke, down into the nursing home to visit without ever stepping outside. Are there any facilities being built like that where you have all 3 levels?
Yes, so Fox Hill actually got rid of the nursing home. Now it's an assisted living so it's called Birch Grove. But so what you're referring to is called a CCRC. It's Continuous Care Retirement Community. And they have all 4 levels. So like Newbridge on the Charles, which is in Dedham, you start out independent. It's very expensive over there. The apartments are apartment style is about 1.1 million, and a single cottage is 2.2. Again, you would get 90% of that back, but they have a great assisted living and a great nursing home, and you're all on the same campus, which is very helpful. So, and what they do is with the CCRC, which is really nice. So, if you are in, you pay for the unit that you buy, and you also pay a monthly fee. So, say you're paying a monthly fee of $6,000. If you have to transition to the nursing home, your monthly fee stays at $6,000, and the average cost of a nursing home, private pay in Massachusetts, is $17,500. So you're only paying $6,000, which is a great deal, and they have a great nursing home there.
Is that with all CCRCs?
It is.
Linden Ponds and Hingham is a CCRC.
It is. It's all inclusive, and that's why they do it. So that, but again, a lot of them, you have to be independent when you start out, or they won't take you. And when I'm talking about independent, they don't want a walker. A walker, yeah. Go ahead. Yep.
I was gonna ask you about Orchard Cove.
Orchard Cove is nice. That's again a CCRC. So, in Orchard Cove and Newbridge on the Charles are owned by the same company, Hebrew Senior Life. So it's very nice. Yes.
Just so to reiterate on what you said about most of the facilities, if you run out of money, they won't ask you to, or they won't say you have to leave. Is
Oh
there-
no, they do tell you to leave.
Yeah. And are there any that have any kind of a provision that if you do run out of money, there's something you can?
There's a couple. There's the Providence House in Brighton that will do that. If you run out of money, there's also Helkeen owns several communities. There's one in Boston. It's Susan Bayless, and also they have one in Watertown, which is called the Brigham House. And what they'll do is, if you can private pay for 2 years, they'll switch you over into a low income program, they call it, but they'll never kick you out. But you have to be able to private pay for 2 years, and it's anywhere from $6,000 to $8,000 a month. Go ahead.
The other question I have is kind of ironic how previously, say maybe 5 years ago, before COVID, let's say, that every place was looking for you to come. Now you can't get in to where they want you to come.
Right, that they're all full.
Yeah.
I mean, it's amazing that they're all filling up again. And like I said, memory care is really tough. And most people that need memory care, they need it now. I mean, I'm working with a woman, she lives on the Vineyard, 63, and she needs memory care. But she brought that, I mean, she was a drinker. And that's causing a little, we're seeing more and more people that's coming to. So she has a 24-year-old son who has to take care of her right now.
Memory care, Alzheimer's, or is it just,
It's both, it's everything.
so what diagnosis even decides that you must go into?
You have to get a diagnosis of dementia before you can go in. And that's a protection for you, so that, nobody's just trying to put you in memory care. Yes. Go ahead. No. Yep, go ahead.
Oh, yes, hi.
Hi.
So do you know, Bill is your name?
Yes.
Bill, do you know a lot about nursing homes, or is it just assisted living? memory?
Assisted living memory care, but I work with a social worker who I refer her, so I would give, if you were interested, I would give your name to her, and she would call you. And she does nursing home placements.
Can you give me your thought on this idea? I'm in assisted living or memory care, and all of a sudden I have, so it's $6,000 a month. Now, in 2 months, I'm gonna run out of money. So say you take care of me. You know that in 2 months I'm gonna run out of money, and I have no place to go. So I was told many months ago, when you know you're going to run out of money and you have to go to a nursing home, it's best that you go to a nursing home now when you have money,
Correct. It is.
rather than to wait and run out of money, and then you have to either apply for Mass Health because you have no money, and then some nursing homes maybe don't like you if you're on Medicaid, but they like you if you have money. So it's best if you know that you have to go there to come in with money.
That is true. And because and most of them, if you're in assisted living or memory care and you're running out of money, at 6 months they will start that process for you. Because you can go to a nursing home with money. They love people that have money. And then you would spend down and then you'd go on Medicaid. And if you have a little, and what we say is 2 months worth of money, do that when you're going. If you have that money, then also you get your pick of the nursing home.
Yes,
If you're on Medicaid, you don't get your pick. You go where they have a bed.
yes.
So it could be a couple hours away.
Well, the other thing I'd like to add is that it's been sort of a little bit of a crusade with me, and I still don't know how to put all the pieces together. But when you have to apply for Mass Health, giving, you're allowed to keep like $2,000 in your bank. I am so angry because it should be increased, just like everything else is increased. And for us to do that, we do have to go to our legislators and say, give us some more money when we go on Mass Health.
Because, I mean, you can have 2,000 in your bank account, and then they will give you $75 a month for miscellaneous. And now it's nothing.
That's ridiculous.
Yeah, it's nothing.
The other thing I know too, I have a lot of experience with nursing homes. Wait, by the 2-star, 4-star, 5-star, and Medicare.gov. Just because it's a 4-star doesn't mean it's better than the 2-star. You have to really go. And what I did when I went to a nursing home is I went into Google and I Googled, what questions do I ask when I go to a memory care or a nursing home? And I got like 20 questions. I printed the questions, and every place I went, I would meet like Mary. I would go through my questions. I don't know if they liked me or not, but I didn't care.
No, it's your right. I mean, they're not going to, I mean, you have the right to ask the questions.
You have to advocate these, just because, see, you get lost, it's very emotional, and then you go there, and then you write it on a scribbly piece of paper, and then who knows what you do with this. But when you have, they also give you a brochure, so you stick your questions in the brochure, and then I had so many brochures that I labeled number 1, 2, 3, all the way through 10, in case if my sister didn't know where to place me someday, she looked at the brochures. Don't put me in here.
And the nursing homes change very quickly, too. I mean, it's such a big difference between an assisted living to a nursing home. I mean, because the nursing homes are still what people remember them as being, 30 years ago. 4 people to a room, they smell, the food's terrible. Yes, so,
You mentioned when you pass away or whatever, your family gets
mm-hmm.
Fox Hill was that they apartment essentially sale of the values that you bought it, you get the new value.
You do, because Fox Hill is they treat their units as condos. So you own it, you get the appreciation. New Pond Village, you get 90% back of what you paid for it. So even if it appreciated by $200,000, you don't see that. You only get the 90% of what you put down. That's how they do it. Let me.
This is not the subject, but I believe in my mind it's related to the subject. Do you ever get inquiries about the right to die law and how it's progressing in this state?
No.
Okay.
I don't, because again, most of the people that I'm dealing with want to live. They're going to an assisted living so they're not at that point yet.
And also, I think in New Pond, what's still in place is that if you do pass and you get that 90% back, you get it back after they
Sell.
sell the unit?
But the good thing right now, New Pond has a good waiting list.
Right.
What about the Altenheim?
Which,
Or the German Center now?
that's very nice. They actually just opened probably 6 months ago in memory care.
They've had memory care for longer
The
than,
nursing home did.
yeah,
The assisted living now has a memory care.
okay.
So it's different. But the nursing home, you're correct, but it was the nursing home, not the assisted living. Now, the assisted living actually has memory care too. Any other questions?
And how much,
Yes.
and then going into the Altenheim, do you have to buy in?
No.
Or you're rent,
It's a monthly lease.
monthly lease, okay.
Yep. Yes, sir.
Yeah, the ratings they have for nursing homes, different on Google or what have you, all different sites. I take it that they don't mean very much, because some of them, they rate them excellent and they're not.
I mean, if I was, if you're going to put somebody in nursing, go check it out. I mean, you have to go and you have to look around, get a feel for it, because my mother was at Doolittle and then we moved her over to the Maples because she needed the memory care, and we wish we didn't, because it would just, Maples itself has a great rating for the nursing home, but the memory care is terrible. They didn't have enough staff, and they would bring all 35 people out in front of the nurses station. So if somebody had a cold, they all got a cold. It just was not a great nursing home.
Yeah, but I think at one time, wasn't it Naples that was rated very good?
That's what I'm saying. The normal nursing home is rated very well. The memory care is, a subset of that, and it's not rated great. I mean, we'd go there. My mother had 6 kids, and so somebody was always there every day. We'd go and she'd be urine up her back because they just had her sitting in urine all day.
As for your company, that you're associated with, do you also deal with, providing information for people who want to stay in their own homes?
Yes, I would, yeah. I work with a lot of home care agencies. But that can be very expensive. I have a woman right now that her cousin is helping her look for assisted livings, and she's doing 24-hour home care. It's $14,000 a month. 14 for a living.
But there's no buy-in involved.
No buy-in. But you're also not getting anything back. Yes.
Well, excuse me, you don't get anything back from the monthly rentals.
No, you don't. It's only a
just
buy-in.
Buy-in.
Correct. Monthly rental, it's just that. It's a rental.
$7,000, but then your loved one needs this, 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 and this. So now it's up to $14,000. You could go, and you know you're going to spend down, or you're going to run out of money maybe. So if you went to a nursing home, the nursing home is only $13,000. And for your loved one, no, it's hard to detect the future. But if you know that that's going to be the future, it's better to get your loved ones settled in instead of always switching them around. So, and if money is, which I think everybody money, the memory care, I think they have their level, but you're at the very top now. You went in at 6, and now you're paying, and this nursing home is going to charge you 12.
There's a big difference though between a memory care and a nursing home. The only thing, what I tell people is if they can afford right now to pay for memory care, do the memory care, especially if the person's still there, because in 5 years that person may not be there. So if you move them to a nursing home, they're not going to know. But if they're still cognitive and they're aware, I would never put them in a nursing home right away. Anyone else? Yes.
What about care? What's the ratio between patients?
It depends on the nursing home. It's probably going to be at least usually a CSA 7 to 1, 7 patients to one CSA. So, again, it depends on the nursing homes. There's some are a lot nicer than others. I mean, that's why I said if you're ever putting somebody, go check it out. Yes.
I just want to make a comment too, because I've worked in senior living for a long time, including nursing homes. The Department of Public Health regulates nursing homes. Very, very close eye on them. They do surprise inspections. Living is overseen by Office of Health Affairs. They just changed their name. Office of Aging and Independence. But it's more, it's seen as a real estate operation, assisted living. And just kind of.
The social model, right? It's
Right,
yeah.
right.
It's not a medical
And it's like,
model.
well, somebody's regulating this, it must be, it's very loosely regulated, tightly regulated from. I was working at one of the big assisted living during COVID, and we opted to follow the Department of Public Health regulations because nothing was coming out of elder affairs for being extra cautious. There's no way to deal with it. That's kind of something to keep in mind too, that you're kind of on your own with assisted livings, you just don't have that oversight. And also, it's a little more difficult if you have problems too. There is a pathway.
Right. You have to go to an ombudsman.
Right, and there's a grievance pathway that's more clear in my mind in nursing homes. On top of things, they all know about the state. As they should be, if you're one part of this matter.
Could you speak up? We can't hear
I
you.
was just gonna ask you, sir, does that microphone work? I'll pass it around to people who speak. Is it working?
No.
'Cause you said some great stuff, but I didn't hear it either. Sorry. I said up front so I could hear, but if you could,
Sorry, I would have stood up.
if you could stand up, maybe that'd help, okay?
Do you want me to just do real
No,
quick summary?
but everybody
DPH,
else could stand up when you speak.
elder affairs, assisted living.
Go up there with the mic. Do it again. Stand up and do it again.
I don't want to take anybody else's time, so. No. Okay, all right, real fast, okay. So nursing homes, they're considered skilled nursing facilities. In addition to care, they also do rehab, so very often a senior person, if they've been in the hospital, will go short-term to a nursing home. And certainly, this gentleman can tell you more about what's covered, what's not in that situation. Nursing homes regulated by Massachusetts Department of Public Health in this state, DPH, otherwise known as, tight regulations, very tight. They're in nursing homes all the time. You have a grievance with nursing homes, there's an ombudsman program, and it's much more upfront and much more clear. Assisted livings are regulated by the Department of Elder Affairs, and it's more of seen as a real estate situation. It's landlord-tenant. So again, if you've got medical issues, most people aren't one or the other. It's social and medical. It's just a matter of what your mix is as to which care environment is best for you. But it's very different departments of government, very different approaches to care, different approaches to.
Yeah. I mean, there's really no care really in assisted livings. I mean, it's very basic what they can provide. Yes.
Are there still some assisted living where you can go talk to people about what kind of care you need and price is based on that instead of?
You would get every assisted living when you go. If you're interested in it, you have to have an assessment, and the assessment will come up with a care plan, and they would go over the care plan with you and show you what that cost of that care plan is.
So that is not necessarily 45 minutes a day.
It could go up. It could.
I just wonder, I had taken care of my mother in the last few years of her life, and when I took her to assisted living, that's what they did. They sat down and we went went over what kind of help she needed
Mhm.
in the day, and then the price was based on what.
Correct. That's what they'll do when they do the assessment.
So that still is a
Mm-hmm.
possibility.
Yep, they'll go over it and they'll say you're care level 1, care level 3, whatever care level you fall into. And it gets expensive as you go up. Yes.
How much does it cost to go into a nursing home?
How much does it cost for a nursing home?
Yeah.
On average now, they're about 17 a month.
A month? $1,700 a month?
No, 17,000.
17,000.
That would be a bargain. No, because my mother was at Maples like 5 years ago, and we were paying 16.5 privately. Yes.
In relationship to the levels in here, you don't have to go into say a level 4 because you need nursing and so forth. Is that portion of these facilities regulated by the state anyway, the way that she mentioned?
No, and again,
Homes themselves are.
like again, if you need care, like if you need like an injection or feeding tube or anything like that, an assisted living will not take you. You can go in. You can actually. Well, let me back up. You go to assisted living, but you have to bring in private care.
But I'm talking about someone that goes in at a lower level, increases maybe to the third or fourth, whichever is the highest level. There was no choice in the beginning when they went in. They're not going in at the fourth level.
Correct.
But now they're in the fourth level, physically in the fourth level. Who regulates that? Medical care. Is it anything in the state?
No.
Is it being regulated
No, it's
by
it's the community. The community they're supposed to sit with the family and say,
So you really don't know the level of care that you're getting. And how could you ever?
you do know the level of care when you first sign on that dotted line because they do the assessment. They're going to tell you what care level you are. If you progress and you've been there now 4 years, and your needs have increased, they will sit. They're supposed to sit with the family and say, your mom now is at care level. She went from a care level 2 to a 4, and these are the reasons why. She's bedbound. She can't get out of bed anymore. She's a 2-person assist. She needs a pureed diet. But anything medical, they would ask you to leave if it's serious medical. Yes.
I was just gonna say, does assisted living is for physical care, whereas they don't deal with any of the medical aspects.
Correct.
So, if you need somebody to care for you physically, fine. But if you need an injection, if you need medication, none of
They can
that
do
stuff
medication.
is part
They-
of-
They can do medication. But they cannot do injections. They cannot do wound care. They can't change, bandages. They can't do a feeding tube. They can't clean it. They would ask you to go to a skilled. Yes.
If you have several medications and you need them during the day, you will go into a different level of care, I'm assuming.
Not a different, it's called, so they have usually Med 1 and Med 2. Med 1 is 2 pills, I think, twice a day. And then if you go over that, it's now Med 2.
I call it a la carte.
Well, like for benchmark, it's $35 for care level, for the Med 1, $70 for Med 2. Yes.
Can you give us any good news?
Save.
Yeah, for a nursing home.
No, is there legislation for?
Yes.
I just have to say, if people can hear me, I'm overwhelmed. It was a very hard journey for me a year ago, and I've gone through a whole journey, and now my loved one is in a skilled nursing facility. What I went through on my own, and now I'm okay with the fact that he's there. And what I learned through the way, when I went through it, was just eye-opening to me. I never knew, and that's why if I can share things with people, and correct me if I'm wrong, But, you know, I come from that a 4-star, a 5-star is better than a 2-star. So I tried to get my loved one in the 5-star, Newbridge, or wherever, and they rejected him because he had so many issues. And one of them was a behavior issue because of the dementia. Nope, we can't have him. And I was told, because I spent a lot of time in hospitals, and I was told by the people that sometimes know these things, like nurses, and I'm with them more than my family, and they're like, just because it's 4-star, they're not, and I don't know, so I don't want to say that this is true, but in my heart, I think it might be true. The reason why things are 4-star is because they might have your loved one that has a broken ankle. That's a lot different than someone who's screaming out all the time and then needs medication. And then eventually that person is going to calm down. But they're not going to they didn't let my loved one in there. And then, so I ended up in a place that was 2 to 3-star. And because I volunteered for hospice for 2 years, I was able to go into a lot of nursing homes, and I saw what I saw. Of course, I didn't really look, but you kind of see. And where my loved one is now, it's okay. And I think sometimes, and I tell people this too, sometimes smaller is better. You get a big, huge complex, and you get lots of fancy couches. That doesn't matter. And chandeliers, don't be like, this is wonderful.
You're absolutely right.
It's true. And I only knew this, I didn't know anything about any of this. And what I went through, I'm telling you, it was a big learning curve. And now I come here because I want to learn, because I always think I don't know all the answers. Sometimes I think I do, but I don't. And I just like to tell people, you know, because I think when you go through it, it's very emotional. And you don't know who to go to sometimes. And then you're kind of stuck, and then you feel like, oh my God, where do I go? And then people say, oh, come with us, and then you sign on the dotted line, and then a little later they say, oh, now the level of care is going to go up. And what the heck did I sign up for? So you have to.
All true, everything she said. I've done it personally and professionally, and
Yes.
you learn it the hard way.
You learn it the hard way.
Yeah.
I had a very bad experience because stole her ring, stole her teeth. No, literally. There was people down the hall screaming because they fell out of bed and they weren't being taken care of. So there's a lot going on. There was this lady next to my mother, and she was assigned over her bed. She had to be fed. So they brought her a tray in and dumped her tray there. And if I wasn't there, they would have taken it away since she didn't want to eat it. Without feeding her. I
Yes.
mean,
What is your name? Linda. What Linda said about being regulated by the state, I mean, they have responsibilities, and they know they have responsibilities. I don't have a lot of background. My mother was in assisted living for a short while, and the executive director, a few years ago. Who decides that my mother had to go to a different level years ago? Well, it was the executive director. Why? Because she couldn't take the french fries now up to her mouth because they kept falling off the fork. And Mrs. Johnson needs another level. And I'm telling you, we went wild. She could eat. Who decides that? So Linda's point, you get the state behind you, and I'm not saying nursing is better than assisted living. I don't really know what the answer is. But it's something that you really have to think about, and you might be on your own about it, but you never know, where do people go to get answers? So many times people are on their own.
I just want to mention another resource. have an information and referral line, and they do have various programs. It used to be that only the services that they could provide were for low income, but now they also provide services, sliding scale, or even just information and referral, just to kind of get you started. Does need to go into a nursing home, they need to be evaluated by a nurse, so that's one of the services they provide. But yeah, definitely check in with HESCO as well. And I think, the services that you provide are really valuable as well, because to your point, where do you go to find out where the good ones are? Where he works with a lot of them, he gets the feedback from customers, clients. But it really, you have to do your homework. Each person is unique. I hope some of the comments we made didn't scare you, but just kind of made you kind of stop and think, buyer beware, ask questions. Yeah.
You
Yeah.
go different times,
Yeah.
8 o'clock, and show up at 3 o'clock. So they don't know you're coming at 3 o'clock every single day. They'll put on good impression at 3 o'clock for you.
Yes.
You have to go different times. Absolutely. And often, yes.
And your service is free, right?
Correct.
I went to you and said, Bill, I need assisted living. So who do I go to? So I would go with you to the assisted livings,
Mm-hmm.
and then it's nothing out of my pocket.
Nope.
And then I tell you that I would prefer a pool and good food.
And it's based on like what you can afford per month, the zip code you want to be in, because the closer to Boston, the more expensive it is.
And do you look at the person's finances, like to help them out to decide?
They'll tell me, like, most people that are, not of course the memory care, but the assisted living, those folks know what they can afford. The majority of them, and usually family is involved. For memory care, it's the kids. And then there's a lot of bickering about the finances. A lot of kids, they say that's their inheritance. They don't want to spend it.
And on another note too, if you can get a place for your loved one that's close to you, because you're always going there, good.
Go
The
ahead.
other thing I wanted to ask you, if you've ever heard of this concept, I was in Florida, but it was several years ago. And there was a church that had a convent, but they were closing the convent. And what a couple of retired nuns did was they got a group together, not all nuns, but they got a group of women together, and somehow they made the building, the convent, sort of like a
Rest home?
rest home, whatever. But they all had special, they were like 2 to a room, but they had a community kitchen. And they were living there within their financial abilities. And they didn't exclude anyone. If they had space, you could come in. I mean, it was maybe 20 people, but have you ever heard of anything like that?
In Wellesley, Elizabeth Seddon, which is a nursing home, there was a convent on the campus, and they just converted the convent into a rest home. But it's funny, you go there, and a lot of the rooms say sister, so-and-so, sister, they're all still in there.
That might be an incentive to stay alive.
Yeah.
It's just around the corner from Mass Bay, right?
Correct.
Yeah.
Yep.
Okay, I know right where it is, yeah.
And it's not that expensive. It's actually like, it's like $3,500, but you're literally going into a nun's old room. It's very, it has a twin bed, a desk, and a chair. But they're tiny rooms, but it's a good concept
I
because,
bet there's a waiting list.
no, not right now. I think it kind of freaks people out when they say sister, on the door next to them. All right, I think we'll wrap it up. Thank you all for coming. Appreciate it.